Dear health workers, welcome to Crystalloid Nursing Procedures channel. Today we discuss IV fluids and their use as IV fluids and electrolyte replacement types of IV fluids. All you need to know about IV fluids when you work as a nurse is in this video. Watch carefully and completely. This channel will give you enough knowledge and boost your confidence in health workers, especially when you go for an interview or if you need to improve your medical knowledge. If you are a health worker with a career gap, you can recollect what is most required in this profession. IV fluids. What's actually in IV fluids? IV fluids usually contain electrolytes like sodium and potassium, things your body needs, especially after a long night of questionable life choices. Intravenous, IV, fluids are solutions administered directly into a vein to treat or prevent fluid imbalances, electrolyte disturbances, or nutrient deficiencies. They are commonly used in hospitals to manage dehydration, electrolyte imbalances, blood loss, shock, and various medical conditions. IV fluids can be broadly classified into crystalloids and colloids, each having specific types and purposes. 1. Crystalloid IV fluids. Crystalloid fluids are the most commonly used type of IV fluids. They contain water and electrolytes, such as sodium, potassium, chloride, which closely resemble the body's plasma composition. Crystalloids can be isotonic, hypotonic, or hypertonic based on their osmolarity relative to body fluids. A. Isotonic crystalloids. These fluids have an osmolarity similar to that of blood plasma, so they neither cause cells to shrink nor swell. They distribute evenly in the extracellular compartment, intravascular and interstitial spaces, making them ideal for volume replacement. Examples of isotonic crystalloids are normal saline, 0.9% Na.Cl, lactated Ringer's solution, LR, and Ringer's solution. B. Hypotonic crystalloids. Examples of hypotonic crystalloids are half normal saline, 0.45% Na.Cl, dextrose 5% in water, D5W. The purpose of hypotonic crystalloids is to hydrate cells in cases of intracellular dehydration, for example, hyponatremia, but must be used cautiously to prevent cell swelling, especially in the brain. C. Hypertonic crystalloids. Examples are hypertonic saline, 3% or 5% Na.Cl, and dextrose 10% in water, D10W. The purpose of hypertonic crystalloids is to increase intravascular volume by drawing fluid out of cells, typically used in cases of critical hyponatremia, brain injury, or cerebral edema. 2. Colloid IV fluids. Colloids are IV fluids containing larger molecules, such as proteins or starches, that remain in the intravascular space and exert oncotic pressure, helping retain fluid within the blood vessels. Colloids are used to expand plasma volume rapidly. A. Albumin. Albumin is a natural protein found in blood plasma. Albumin IV solutions, available in 5% or 25%, are used to treat hypovolemia, hypoalbuminemia, low blood protein, and shock. It is also used in patients with liver cirrhosis or kidney disease. B. Gelatins. Gelatins are used for volume expansion during surgery, trauma, or shock. Examples of gelatins are Hemexcel and Gelofusine. C. Dextrans. Dextrans are polysaccharide-based solutions that help expand plasma volume. Dextran IV fluids are used less frequently due to potential allergic reactions or coagulopathy. Examples of dextrans are Dextran 40 and Dextran 70. D. Hydroxyethyl starch, HESEs solutions are synthetic colloids used to increase plasma volume. They are typically used in surgery, trauma, or severe hypovolemia but are associated with side effects like kidney injury and coagulopathy, so their use has declined. Examples are Voluven and Hetastarch. 3. Blood products and plasma expanders. Though not typical IV fluids, blood products are administered via IV to manage specific conditions like anemia, coagulopathy, or severe blood loss. A. Packed red blood cells, PRBCs. PRBCs are used to treat anemia or acute blood loss, as they increase oxygen carrying capacity without significantly increasing fluid volume. B. Fresh frozen plasma, FFP. FFP is used to treat clotting disorders or massive transfusions. For example, in liver disease or warfarin overdose. The purpose of FFP is to provide clotting factors and plasma proteins. C. Platelets. Platelets are administered to patients with low platelet counts, thrombocytopenia, or bleeding disorders. The purpose of platelets is to prevent or treat bleeding in patients with low platelet counts. Key considerations for IV fluid therapy. The choice of fluid depends on the underlying condition, for example, dehydration, shock, electrolyte imbalance. Rate of infusion is an important factor. Infusion rates vary depending on the patient's condition, for example, slow for maintenance, rapid for resuscitation. Patients receiving IV fluids need to be monitored for fluid overload, electrolyte imbalances, and potential side effects like edema or heart failure. In conclusion, IV fluids play a vital role in medical care by addressing fluid, electrolyte, and nutrient deficiencies. Crystalloid solutions are commonly used for general fluid replacement, while colloids are preferred for plasma volume expansion in critically ill patients. Blood products, although not typical IV fluids, are essential in treating anemia and coagulopathy. Understanding the purpose and appropriate use of each type of fluid is essential for effective treatment. If this channel is helpful for you in gaining knowledge, subscribe and utilize this channel for a bright future.